So, some of the things that we're going to go over today about blood vessels are the principles of blood pressure regulation and the stages of shock, factors affecting blood velocity and flow. We're going to differentiate between venous and arterial vessels and the factors associated with the regulation of homeostasis of the peripheral circulatory system. And also, we're going to describe the structure and function of each type of artery, vein, and capillary, and where they are also found. So, first, we're going to start with the blood pressure regulation. Neural regulation. Um, there's the baroreceptor reflex, which detects rapid changes in pressure, signaling to the brainstem to adjust the sympathetic and or parasympathetic production. And then there's rapid adjustment, and this is when the blood pressure drops. The sympathetic system raises the heart rate and vasoconstriction to increase the pressure. Then there's hormonal or chemical regulation. Um, there's the renin, angiotensin, aldosterone system, and this is activated by reducing renal blood flow. And then there's vasopressin, which increases water retention, causing vasoconstriction to increase the blood pressure. And then we have renal regulation. The kidneys help regulate the blood volume by controlling the sodium and water elimination. Um, and then healthy blood pressure ranges are normally between normal ranges around 120 over 80, give or take. And there are 3 stages of shock. Stage 1, that's when the body detects that there's something wrong, um, or low blood flow. This can lead to faster heart rate, constricted blood vessels, faster breathing. Um, that all happens to help maintain the normal blood pressure. Symptoms of stage 1 is cold or clammy skin, anxiety, or nausea. Then there's stage 2. This is when the blood pressure drops. Then your mental status changes. You get confused or could be lethargic. Um, your organs are seriously impacted in this stage, and this could lead to metabolic um, acidosis and uh, anaerobic metabolism. Stage 3 is the most serious. In this stage, there is damage to the organs, and most of the time it isn't survivable. Even if you're able to get your blood pressure back to in the normal ranges, the damage is already done, um, and there's no going back. And this results in multi-organ failure and even death. So the main factors affecting blood flow is velocity. Um, affecting blood flow and velocity is pressure and resistance, and the vessel cross-sectional area. Vessel diameter, vasoconstriction or dilation, blood viscosity, pressure gradients, and the cardiac output are all important factors. Um, Flow is directly linked um, to the radius, but oppositely related to viscosity and vessel length. So the difference between arterial and venous vessels, so their functions, uh, arteries take blood away from the heart, and veins take the blood to the heart or towards the heart. The structure, arteries are thick and muscular, um, and veins are thinner and less elastic or less elasticity. Their pressure, arteries run on higher pressure and veins run on lower pressure. Valves, veins have one-way valves to prevent backflow, and arteries don't. Arteries are deeper in the muscles, while veins are closer to the surface or the skin. So the factors of regulation of homeostasis, there's one is the local factors, which are myogenic response and metabolic controls. Two is neural regulation, which is baroreceptor reflexes, vasomotor centers, and vein control. Three, endocrine and hormonal regulation, renin-angiotensin, aldosterone system, antidiuretic hormone, arterial natriuretic hormone. Number four is physical factors, which is the skeletal pump, muscle pump, and then respiratory pump. For example, following bleeding, the renin-angiotensin aldosterone system that works to restore the blood volume, while the sympathetic activity raises the heart rate and constricts the arterioles. And then arteries, so they carry blood away from the heart. They're thick, they're muscular, they have elastic walls, they're small lumen, they lack valves, they have three layers, which is the intima, media, and externa. They deliver oxygenated blood to the body and the tissues. So elastic arteries, those are the biggest, and they're found closer to the heart. Muscular arteries are medium sized and they branch off of the bigger arteries. Arterioles are the smallest arteries, and these are the ones that connect the arteries to the capillaries. Capillaries are bridges between the arteries and the veins. They have very thin walls with only one layer of endothelial cells. They exchange oxygen, nutrients, and waste products between blood and tissue cells. They are also found in capillary beds almost all throughout all the body tissue. And then last but not least, veins. So veins return the blood to the heart. They have thin walls, large lumens, valves to prevent backflow, and less elastic tissue. And these ones are closer to the skin, and some are deeper major vessels. And thanks for watching.